So my background is I'm an internal medicine physician. I started off in internal medicine and then got my specialty in critical care, followed by pulmonary medicine, and um, and then got a specialty, did a fellowship in sleep medicine as well. So once I had gotten all of that, I then went into practice, and about 2 years ago, completed an MBA. I started my MBA in 2016 because, like me and Jerry were just talking, I felt I could do certain things in what I wanted, but I felt a little straitjacketed, and I thought an MBA would help. I did the opposite. It actually during the MBA, and so this is where I guess sleep comes in, and kind of the burnout idea. Burnout is not working too hard. I was managing a full practice, uh, inpatient, outpatient. I was doing critical care. 1 week I was in the office, sleep studies, pulmonary patients, sleep patients, inpatient, outpatient consults, and then the week after back in the ICU again. So I was working my butt off, and the issue wasn't, and I was still traveling twice a week to Chicago to do take classes in my MBA. And so it wasn't really the MBA itself or the hard work that caused me to burn out per se. It was the fact that I felt powerless in my organization. It felt like I had no say in what I wanted to do. I think Resilient Doc is a beautiful project, and we need to kind of figure out the work environments that we work in, and how we can thrive for ourselves, but for our patients. The main reason why we entered the profession, the main reason why our profession is seen as a noble deed. Obviously incentives matter, organizational structures matter, but what is sacrosanct is that provider and that patient relationship. And I think building that within you, and this, you don't want to misconstrue it as blaming the provider for not being resilient enough. What this talks and this sort of endeavors are meant to do is actually bring focus to things that we can do in our lives that we control, because there's certain things that we cannot control. But how do we optimize things well within our ability to control, that we can do for the betterment of our health, our career, and for our patients? So wanted to give this talk a little bit about sleep and your career. And like I mentioned, Omar mentioned as well, I left my employed practice last year, wanted to figure out a better way to serve my patients, realized what I did could be done via telemedicine. A lot of what I could have done. I used to feel that it was a waste of time for a lot of my patients to come into a waiting room and see me. Felt it was a model that could be, I guess, hacked or optimized, and was honest with myself about how much of a physical exam changed my perception of what the patient needed, or what the clinical diagnosis. A lot of times the history taking was a lot of what I did. And I think telemedicine now has allowed me to do that, because all I do is listen. The physical exam is a minimal portion of it. But I'm not saying that all patients are right for telemedicine. But I think getting access to more patients because of issues in terms of getting them through the door, finding an afternoon that's available. And so that's why I set up my virtual practice. We do everything from evaluation to testing to treatment, all from the comfort of your home. And so I wanted to thank Omar as well for inviting me here this morning. So why is sleep important? I think it's a given. I don't think we give it enough thought, though. And so what we want to do is actually bring focus to it. It affects your health. It increases your risk of heart disease, strokes if you don't get good sleep. It affects your ability, your increased likelihood of developing psychiatric disorders as well. It causes weight gain. So there's significant health issues with sleep. And I'm not talking about just insomnia, but sleep apnea, insufficient sleep. All of these put together actually has a huge toll on you, your career, the performance as well, the ability to perform at work, your executive decision-making skills. That is all affected. They have these tests where you can do, it's a psychomotor vigilance testing, or PVT, where they for certain jobs that require a lot of attention, like utilities, nuclear plants, in the military, a lot of national security issues. They find that sleep has been getting a lot more focus now, because they realize how much it affects the employees, it affects the safety of what they do. So not only the performance of the upper management or the management team itself, But then the safety. So we talk about the safety next as well, where we have truck drivers, we have people that handle utilities, people that are taking care of other patients. And so it's a safety issue as well to make sure that all of this jives. And I think a lot of times we've seen sleep as an inactive state. Um, you think of your daily life, your work, your family, everything else that's in daylight hours, and sleep is just happens as the residual of all of that. But the idea of this talk was actually bring more attention to how you can optimize your life with sleep. And I use the word optimize, not sounding like some sort of uh, you know someone who's trying to take charge of control of their lives and tweak everything and optimize. And I don't want it to sound that way. But what I mean is to be able to shed more light on sleep so that you live a better life. And that's what the goal is. And that's where the quality of life comes in. How you interact with your family, how you interact with your patients, your colleagues, all of this, how you feel about yourself, how you feel about the day, how you feel about the weekend. Are you looking forward to things? Do things excite you? And how sleep plays into all of that. Oops. And so this is not meant to kind of go bore you all with stages of sleep. The reason I brought this up is because I had, my sister took a screenshot recently of, was it a Fitbit or an Apple, I think an Apple watch. And she was like, am I getting enough deep sleep? And I'm like, yeah, your N3 looks great, but it doesn't shed light on what's normal and what isn't. So generally we will get non-REM sleep and REM sleep. There's a sleepiness phase where you're dozing off, you go into N1 sleep, which is a lot of alpha waves and a slightly higher frequency. It's a little hard to detect whether you're awake or asleep, but you're in that drowsy, very drowsy state. And then you go into N2 sleep. N2 and N1 sleep are considered light sleep. So you'll see some of these Fitbit devices and so on categorize it as light sleep. That should make up around 60%, 55 to 60%. With N2, it's or stage 2 sleep making up about 50% of your overall sleep. N3 should take up a little bit less than that, but REM takes up about 25% of sleep generally. So 20 to 25% REM sleep, you will end up having about 50% stage 2 sleep. So that's about 75% left, or 30 or 35, 25 or 30% left. And so that is about 5 to 10% with N1 and about 10 to 15% of stage N3 sleep. And you'll see how that all plays out in a little bit. So this is a hypnogram. It just kind of shows you why you need your 7 to 8 hours of sleep. We generally will go through a cycle. So these cycles of when you fall asleep and you hit your first REM, which is this black mark over here, there's generally about an hour and a half. So 90-minute cycles when you get into REM sleep, and then you come out of it and then you go back into another cycle. So you need about 4 REM cycles, about an hour and a half each of them, to kind of get you into the 7-hour period. So the 4 REM cycles that you go through is what you really need. And that's why, you'll find that the architecture of sleep changes dramatically. We've seen when you add medications, when you don't have good sleep and then you have catch-up sleep over the weekend, the architecture of sleep is very different. Now, there's also a lot more data today of what REM sleep and what non-REM sleep does, or what are they taking care of. And I don't think we really fully know right now. But what I know is REM sleep is very fascinating because, REM sleep is supposedly the deepest state of sleep, but it's actually when your body, your respirations become the most irregular. Your heart rate as well can become tachycardic. There's a lot going on at that point when we still haven't really fully kind of fleshed out what it means, but we do know that it actually affects your ability to kind of what kind of sleep you get depends on how many REM cycles you get as well. We find that interestingly that in antidepressant medications, for example, for whatever reasons, they work by actually suppressing the amount of REM that you have. And so we find there's less REM in certain SSRI patients on SSRIs and so on, which is very interesting. And then when you have patients who take a lot more benzodiazepines, they have a lot more alpha sleep, which is the lighter sleep. And so, so that kind of gives you an idea as well, just talking about benzos as sleep aids. What it ends up doing is just sedating you. It doesn't actually guarantee you better sleep. So it's a great tool to use for short term, but it's not really a good tool to use to ensure good quality sleep, because you do need your REM cycles and your regularity of that. But yeah, so enough of the sleep architecture. If y'all have any questions, just post that out. I'll be happy to kind of talk through that as well. And so before we go into this, I wanted to actually just put up a quick poll as well about what everyone thought as what would be considered normal sleep, or how much do you think you need, more importantly, not so much how much you think is normal for most people to have, but how much do you think you need. And the best way to really figure this out is to have a few nights in a row, maybe 3 to 4 nights, when you're not working the next day, or if you are, you don't have to wake up with an alarm, but go to sleep and then wake up the next day, go to sleep, wake up the following day, go to sleep, fall, and figure out what the hour is, that the amount of hours that you need to actually wake up feeling refreshed. And that's the goal. And that's when you kind of figure out. Initially, when I was in my 20s, you always have this idea that you're invincible and nothing can touch you. And I can get away with 5.5 hours of sleep. I'm Superman or Superwoman or super person. But that's not the case. And what I've noticed when I started doing this is trying to figure out, all right, so it shows here that some people think it's kind of a tie between 7 to 8 to 8 to 9 hours. And so there's a U-shaped sort of curve in terms of long-term, what's good, what's enough sleep. So we find that anything above 9 hours tends to herald something that's clinically significant that needs to be addressed, and then increases your mortality. Less than 6 hours also causes that increase in mortality. But 7 to 9 hours is considered what you overall need, and most participants were in that range. Thank you for that poll. So when you're assessing your sleep, the quantity of sleep is important. How many hours? And so this is also the ability to have that sleep. You need to actually ensure that you have a protected period of sleep. If you give yourself only 5 hours of sleep, meaning that you go to bed at 12 o'clock and you have to set your alarm at 5 because you have to wake up and get ready and go to work and drive 45 minutes and so on, you're not giving yourself, that's insufficient sleep. So you have to really be able to give yourself quantity of sleep. So most adults, 7 to 8 hours is what you generally need. Now, again, it's a bell-shaped curve. What I want to encourage you all to do is actually try this out, where you'll sleep a few days without actually having too much alcohol or any alcohol on board, any sort of sleep aids on board, but just go to sleep and wake up and see over the next few days, how many hours do you need before you wake up spontaneously and feel refreshed? And that's going to be the average of quantity you personally need. The quality of sleep is important as well. Whether you're waking up a lot, whether you felt like you woke up feeling refreshed. How do you feel when you wake up? I feel great when I wake up. And that's something that I sometimes feel bad, because I lack a little bit of empathy for my patients, because I don't feel, I don't feel bad when I wake up. I guarantee I always try to make sure that I have that 7 to 8 hour window. Obviously, when I don't get that, I feel tired and I know exactly how they feel. But generally, when I wake up, I feel excited to take on the world. I feel refreshed. I don't need coffee to start the day. And so these are some of the things that you should expect, that how you should feel. It's in my line of work, it's been refreshing and kind of frustrating to see patients come to me after so many years and actually have such a frustration with, or such a mismatch about what they consider to be normal sleep. They've woken up tired for such a long time and used caffeine and used energy drinks and so on as a crutch, without even thinking about, why do I feel this way? And then once you start trying to actually decipher that and actually get help for it, and you start sleeping better, patients are like, oh, I didn't realize this is what good sleep. That's why my partner kept waking up and felt great in the morning, and I was just irritated with them because they seemed like they were all excited about facing the day, and here I was, snoozing over and over again, needing a cold shower, needing a whole hour before I really felt like I was awake. So the quality of sleep is important, being honest about that, how you feel. Sleep complaints, I wake up a lot, I use the restroom a lot, I'm snoring. These are things that you should always kind of see. I run a lot in my sleep, or I toss and turn a lot in my sleep. I feel my sleep is restless. These are all complaints that you should kind of be honest about, especially when you're trying to assess sleep. And so when I keep saying assessing sleep is the same way that, if you look at the 3 pillars of health that I consider, you have nutrition, you have mobility, and then you have sleep. And I want you all to kind of be more introspective about your sleep and what complaints and what truly things that need to be changed. And once you actually shed light on it, there's many things you can evaluate, like that restless sleep or the running in your sleep. Are you smoking? Is there cigarette use? Is there stress in your life? How much caffeine are you using? What medications are you taking that's affecting that? So all of these kind of, you ask the first why, in the Japanese management system, you ask the 5 whys. So why am I feeling that way? So, okay, this is my legs. And then why are my legs moving around so much? I notice my legs move around when I'm stressed. Okay, why? Okay, stress causes this. I'm drinking more caffeine because I'm working on projects. Oh, okay, maybe that's what it is. And you start messing around, you experiment in your own life to kind of try to see whether that can be addressed. Observed abnormal behaviors. This is the most amount of fun in my sleep field, because the best is to always have the patient, and then you have the caregiver, or sorry, the spouse or someone. And it's nice to see when the spouse rats out and says things like, oh, they snore, or they do this funny thing in their sleep, or they do that. So abnormal behaviors, observed behaviors like stopping breathing, which is apnea, is probably one of the highest correlations to diagnose sleep apnea. So once a spouse says that, oh, I see them struggle to breathe or stop breathing or choking in their sleep, I don't need a sleep study to confirm that, but for insurance purposes, I have to show that they officially have sleep apnea. But that has probably got the highest correlation to diagnose that. So observe behavior. So if your spouse or your partner says there's something about your sleep, sometimes we take our sleep a little personally. So I'd say, take it with an open mind and say, oh, really? Is that what I'm doing? That's interesting. Let me figure out why I'm doing that. And so assessing your sleep is important. Now, what's the regulation of sleep? So it has three kind of overlapping. One is homeostatic drive, which is basically once you wake up and all that junk that you're thinking of and all the byproducts of your brain and thought and thinking about what you're going to wear and thinking about what you're going to have for breakfast or thinking about what to write in an email and, talking to your spouse on the phone or your parents on the phone, all of these things, these activities accumulate toxins, and adenosine is one of them. And that's why coffee works well, because it acts against that. But the more adenosine that builds up actually drives more need for sleep and then clearing up of all this junk through the lymphatic systems. So homeostatic drive is one of them. That's accumulation of sleep drive as the day progresses. Then you have the rhythmic changes of life, which is your circadian rhythm, which is driven by light. And that's where you kind of need to sink in your propensity to stay awake or fall asleep with the light schedule outside or the light schedule inside. And that's why as we work more inside buildings, we have to ensure that we have the adequate light exposure, whether we're working nights or whether we're working days. But these are some of the things that you need to kind of ensure that you sync. The balance between REM and non-REM is also fascinating, because we find that the catch-up sleep that you think you get, like, oh, I sleep 5 hours from Monday to Friday, and the Friday nights, I sleep in for 10 hours or 9 hours and so on. But we find that the quality of sleep or the kind of sleep, you actually get a lot more non-REM sleep in those catch-up nights, as opposed to proper REM sleep. So kind of REM sleep, think of it as the gift of regular good sleep. And if you don't get enough of that, there's something, again, I can't tell you that REM sleep will, lack of REM sleep will cause you this. We haven't figured that true part out yet, but there's a lot of fascinating things going on during REM sleep that we will soon hopefully find out. So this kind of gives you a pictorial idea of how the accumulation goes on. So when you wake up in the morning and your propensity to stay awake, your circadian drive, because your light exposure in the morning and you're all active and so on, and then you have this little dip over here. But the sleep drive, this is the accumulation of all the junk in the brain that I was talking about. As that kind of comes to head after 9 o'clock when you're awake, and then that's when you fall asleep, because this is when it overcomes your ability to stay awake. When that sleep drive or the homeostatic drive overcomes the circadian drive itself of staying awake. And you'll find over here, for example, this is where it's interesting. You see this dip in the afternoon, we all feel it. And so what we need to do is just ensure that we schedule our days so that you can, if you have the ability to, you schedule a day so you're doing stuff that doesn't require that much of creative thinking, that much of executive decision-making skills at that time of the day, because that's not going to be a time of day that's adequate. You want to kind of keep your creative stuff, your brain thinking part, your problem solving part in the day, earlier in the day, and leave maybe answering emails or catching up on notes or paperwork at that time of the day, because that's the time that you really want to kind of the mundane stuff that you need to do. That's the best time to do it. So that kind of gives you an idea of your propensity to stay awake and sleep. Now, obviously this goes out the window when you are a night shift worker, and a lot of healthcare workers are shift workers. And so that we'll kind of touch on that in a little bit. So sleep loss itself is, there's obviously chronic and there's acute. So in acute, we find that there's response time, your ability to react to stuff quickly. So this is where I was talking about the safety issue when you're dealing with utilities or heavy machineries or nuclear power plants or people in the military and so on, people who are driving for a living or flying a plane, for example. These response times are important. It also affects, they found that acute sleep loss can also mimic drunkenness. So when you're driving as well in your reaction time. So there's a lot of these new sort of companies that have come up to address this by testing employees with psychomotor vigilance testing, and you can kind of play these games on your cell phone to see how awake and so on you are. And that's actually important because I think feedback is important. A lot of us will say, well, I'm performing all right. And all right may be fine until that catastrophic accident or something bad happens. And then you realize that maybe you weren't all right well. So I think feedback is really good. So I think this is a psychomotor vigilance testing is a great way, especially for this high intensive jobs that require to be really on point. Attention is important as well. Our inattentiveness increases as we don't get enough sleep. Mood swings, irritability is another thing. Executive functioning is a huge thing as well, as we're trying, as organizations get bigger, there's more money on the line, there's more critical thinking that needs to take place, how you interact with your colleagues and so on. The mood, the executive functioning all come into play. And also moral reasoning. They find that when you have sleep loss, the way you kind of figure out what's good, what's bad, what you shouldn't do, what you should do gets affected as well. So it's kind of interesting how that goes out of the window when you have sleep loss, especially acutely. Long-term wise, it's, if you think this is bad, then chronic sleep loss is catastrophic, because whatever you do in terms of how you feel now and your cheats of your day, like where you deprive of yourself of an hour of sleep every day and so on, will accumulate. We find that patients who don't get enough sleep have an increased risk of dementia. The deposition of proteins in your brain increases to kind of mimic that dementia and actually increases the likelihood of developing that. Mortality rates increase, cardiovascular disease, weight gain, a risk of alcohol abuse. Patients who have different issues with sleep tend to self-medicate a lot of the times. And you'll find that that's what's driving a lot. Or patients will say, well, yeah, I need wine because I can't go to sleep, or I need a beer, I need a few drinks to really knock me out. It also predicts long-term sickness and work disability. So that's why from an organizational perspective as well, focusing on sleep and the well-being of the employees is important. Glucose levels are altered. That's why we find a lot more insulin resistance. We're finding as well in terms of, like, for example, sleep apnea, it affects your glucose tolerance as well. It increases your likelihood of developing fatty liver and so on. And actually treating of that can actually reverse a lot of the effects of fatty liver. So if you think about glucose deposition, their levels and glycogen storage and so on, it has it's huge metabolic impact. Increased appetite. So there's hormones. When you think about poor sleep as a stress response, when you don't get good sleep, your body's stressed out, on edge, you get irritable, you're tachycardic, you tend to have this stress response, which your body then interprets as, I need more calories because I'm fighting off something, and I need to accumulate those calories to fight the stress state out, or stress state right now. And so that increases your appetite, and you feel less full. And so people who have poor sleep actually tend to graze a lot, keep snacking and eating throughout the day, have cravings and so on. That's because the body's kind of going, you're lacking sleep, you're stressed. We need to make sure that we're ready to face this, whatever stress is coming on. And decrease energy expenditure, because this makes sense. You're not getting good sleep. You're not going to put on anything to say, well, I'm going to go and play tennis now. I'm exhausted. I'm just going to veg out, sleep on the couch. I'm just going to relax. I'm going to read a book and I'm maybe doze off, try to. So again, there's going to be an imbalance between your calorie intake and your energy expenditure. And that mismatch is what drives a lot of the weight gain and then the mortality as well. So you see over here, and I apologize that the slide isn't clear. It looked clear when it was smaller, my bad. And you can see over here when, as the years go by, as people with average lower sleep hours, or 5 hours of sleep duration, they tend to gain the most amount of weight. And this is something concerning. You get the 7 to 8 hours of sleep and it's nice right here, but you get anyone above or below that, you end up having issues. So what I'd like to probably bring up is that more sleep that you get, people are getting about 9 hours of sleep and so on. The reason why there's a U shape, there's a lot of theories behind that, but it's also possibility there's a medical issue that's driving you to sleep in longer as well. So we kind of need to figure out if you're sleeping 9 hours regularly or above 9 or above hours, you need to figure out there's something else, whether it's depression, whether it's an endocrine issue, all of this, whether it's a medication issue that's driving some of this additional sleep hours that you need to kind of. So I think it warrants attention. There's the same way that lack of sleep of 6 hours or less warrants attention. I think if you get about above 8 to 9 hours of sleep every day and you need that, it also warrants attention to see why do I need a little bit more. And as long as you've evaluated that and found nothing, that's fine. I wouldn't say that if you sleep, 8.5 hours, you shouldn't cut down those hours just because, of this screen. But it should warrant at least some questioning about why you need that much of sleep, whether the quality of sleep that you're getting. A lot of times patients compensate by needing more hours of sleep because the quality of sleep that they get that should drive them for 7 to 8 hours, they need more because, for example, if they have apneic episodes or if they have restless legs and so on, are these issues diminishing their quality of sleep? So they actually need a longer period of sleep to get those hours in. And I think I mentioned this before about insufficient sleep. So you actually have to give yourself adequate sleep. So that's why I want to bring attention to you thinking about your nutrition, mobility, and then sleep. When you're going to work, for example, if you're doing shift work or if you have a stretch of heavy duty coming up in the hospital, I want you to kind of understand that you have to also look at, okay, am I getting enough sleep? What am I waking up? What's my commute like? I need to ensure that I do get sleep. Now, it's easy for me to say that and not know your lives. You obviously have barriers, whether it's commute time, whether it's home issues, whether you're caring for someone sickly at home, whether you have a child at home, whether you're pregnant. I mean, obviously, all these things affect sleep. But you have to be honest with the fact that you need your sleep. And it's fine acutely to have a little bit of less sleep, but you need to kind of figure out what your game plan is longer term, especially if you have barriers at home to good sleep. The risk factors for insomnia, older age, usually comes with a lot of other medical problems. Female, we find especially, what's interesting is in men, for example, when they present with sleep apnea, they complain of daytime sleepiness. But when women come in and they actually have sleep apnea, their main complaint is insomnia. They can't sleep well. They can't fall asleep. They wake up early and they don't know why. And so a lot of times women get mismanaged and they get given sedatives and sleep aids to treat sleep apnea when in actual fact they needed a sleep study. So that's kind of an interesting thing that we find, especially, we just think all this while there was always a misunderstanding that, women were just men with hormones, but it's not the case because we understand that even how women present with heart disease is unique. So we actually have to, rather than just respond to an issue, figure out what is driving that insomnia. What do you mean by that? Oh, have you gone through menopause, which then increases your risk of sleep apnea? Are you having hot flashes that drive some of this insomnia? Is it chronic pain? So you kind of have to delve that issue rather than going, oh, you have difficulty sleeping, here's some Ambien, here's some Zolpidem, here's a sleep aid. And you don't want to be a knee-jerk reaction to a problem that actually needs to be addressed in a different way. Shift workers is obviously that. I mean, everyone understands that. We'll talk about it a little bit more as well. So how does it happen? There's this Spielman model of the 3 Ps, the predisposing. So who you are, maybe the genetics. Sometimes it's also the kind of work that you do, the personality that you generally have or keep. And so these are predisposing factors. But we normally need a precipitating factor to get it off, whether it's, sometimes it's going through pregnancy. Sometimes is a string of shifts at night that you've been made to do. Sometimes it's a sick family member at home that you have to care for. At times it could be medications or a new illness. Let's say you get diagnosed with asthma and breathing is an issue and that keeps you up at night. Or if you have a newborn and you keep waking up. And so sometimes whatever precipitates that sleep issue is a defensive mechanism, because, for example, if we have to wake up multiple times to feed a child, you want to be hypervigilant and always kind of, as soon as you wake up, you want to see what's going on and you want to be aware. You're like, did I feed the child? Is the child all right? Or if it's a care, you're giving care to someone who's sick in your family, is that someone that, are they fine? Did I miss something? Were they calling out to me? Was that crime committed in the neighborhood? Was a shooting that kind of made, am I safe? Is this, and you wake up and you're like, oh my God. And so that's a precipitating factor. And then we tend to uh, set about some sort of defensive mechanism. So for example, let's talk about crime in your neighborhood. If you have crime in your neighborhood, you wake up and you're like, oh shit, did I lock the door? Did I do this? Oh my God, did I set the alarm? So you wake up and then you check the house, you lock the doors, you make sure you do that. You check your phone, whether your alarm is set. And so what happens is then you end up having this sort of immediate reactions that you had to respond, the precipitating what your response to the precipitating factor, which was fine at that moment in time, then perpetuates the behavior. So then you end up doing it and you end up waking up and you end up having poor sleep and you end up thinking about, oh my God, before I sleep, did I do this? Did I do that? So as opposed to falling asleep and relaxing, you're actually becoming more and more vigilant. And that perpetuates it, because then now whenever you go to sleep, you're not falling asleep quickly. You then go, oh gosh, sleep is such a pain. I'm not getting enough sleep. This is what's happening. I hate sleep. I need to take medications. I need to take alcohol. I need to drink more. Maybe I need to have a cigarette to calm down. So all these things then perpetuate that behavior, because now sleep hasn't become this sort of safe haven or sanctuary for you. You're waking up multiple times. You're doing this and so on. So then that perpetuates that behavior, that frustration with sleep. And that's how we end up kind of perpetuating the behavior. So this model, I think it's very helpful because it helps us understand what are the behaviors that we are now doing that makes us more likely to perpetuate that poor sleep. So one of the few things that I go through frequently, and there's this, so brief behavioral therapy is a subgroup or a subset of cognitive behavioral therapy about how to change your thought process, how to change some of these behaviors behind poor sleep, and trying to ensure that that you actually are able to get better sleep. Now, that being said, before you dive into brief behavioral therapy, is to actually make sure that you're not suffering from any other sort of medical condition that is driving poor sleep. This is more of the insomnia. If you're having issues with falling asleep and you have no other medical problems that are actually causing that, and you've looked at the medications, you've looked at your overall health. But one thing is to kind of reduce that time in bed, meaning that a lot of times, especially people who are type A personality, they want to take charge. They've got their Fitbits. They're like, I need to sleep. I need 8 hours of sleep. I'm going to give, I heard Dr. Bhar speak, and I'm going to give, I'm going to focus on sleep now. And I'm going to do this. Unfortunately, that sort of take charge attitude is also counterproductive for sleep, because sleep is a process of falling asleep. It's when you let go. It's when you kind of go, you fall back asleep. Not when you're trying to take charge of it. So you're not trying to optimize sleep. Like, I need to sleep now. If I don't sleep now, I'm never going to feel great the next day. So you want to make sure that you time your bedtime to the time that you actually are sleepy. Because if you don't, when you get into bed and you're awake, tossing and turning and worried about the fact the next day you're going to wake up tired because you're not getting enough sleep, that actually heightens up your anxiety towards sleep as opposed to reducing it. So you want to make sure that you're timing your bedtime right. The bedtime has to kind of coincide with how sleepy you feel. For social reasons, a lot of people say, well, 10 o'clock is what time, my wife goes to sleep or my husband goes to sleep, and I want to sleep at the same time. But if you're not sleepy at that point, you're setting yourself up for failure. Now, some people, and I go to sleep within a few minutes. My wife takes longer, and I'm a source of frustration to her. So you can tell, that's why it's kind of better to sometimes reduce time, but make sure you don't reduce that time by you looking at your phone to try to wait for you to go to sleep, because that's going to kind of be counterproductive, because the light is going to be activating. But the most important thing I tell all my patients is to wake up at the same time every day. You set a time that you feel reasonable to wake up. This is the time that I really need to wake up to go to work, or to take, get my kids ready for school, or to take my medications and so on. You have to be honest about the time that you want to wake up and actually set that as a ground rule. Because what happens is when we end up having irregular wake times, it also drives irregular sleep times. And when you have that fluctuation, if you go to sleep here and you're only really sleepy here, that hour that you are is going to drive that anxiety. So you need to set that up so that your wake time is actually the same time. And you see, the wake time, once you wake up, is when we go back to the chart that I showed you about, that homeostatic drive for sleep. the accumulation of all that, where the fatigue and all the toxins and the adenosine that drives your sleepiness, once you wake up at a certain time, your body really has no ability to stay awake past 16 to 18 hours after that, because that's when that cliff falls off and you fall asleep, right? So when you wake up at the set time, your ability to fall asleep at the set time as well is going to happen. So you can't, that's how you mimic that, because it's a lot harder for you to say, I'm going to go to sleep at 10 o'clock today because I need my 8 hours sleep. Your body may have other plans in mind because the last night you slept at 11:30 or 11:15, and your body is like, well, I still got a little bit of energy in me. You want to read a book? You want to play a game? Hey, you want to do this? You want to plan the next day out? So your body may have a different idea. So you want to make sure that you set your bedtime, your wake time, and then your bedtime will slowly fall into place as well. But I want y'all to do this in a day when y'all are not working the next day, because sometimes when you set your wake time at a specific time, you're going to wake up, you might feel a little tired because the last night when you first started it off, you didn't get enough sleep, your 7 to 8 hours of sleep that you needed. But after a few days, you will sink and you will realize that you start falling asleep. And that's why we have this thing called social jet lag, where there's variation in your sleep time and your wake time on weekdays and weekends. And then when you go to sleep on Sunday, because you've been partying it up over the weekend. And when I mean partying it up, even for people in their middle age and older age, it's whether you go out for dinner, whether you have family over and you end up sleeping at midnight, and then Saturday night, and then the Sunday, you're like, oh, I got to go to work the next day and I'm not tired at 10 o'clock. And so that's what social jet lag is. So that's why it's important to set the wake time every day. And that drives your ability to fall asleep at night. What it also doesn't allow you to do is cheat, meaning that the body doesn't get rewarded for sleeping like, oh, I slept only at 12 o'clock. So maybe tonight I'll sleep in a little bit more, because that is going to cause a problem for the next night as well. So you need to make sure you set up on your same wake time. I'll stop harping on that, but that's really effective. We've talked about do not get into bed when sleepy. Now, do not stay in bed unless asleep. But I know a lot of people that watch TV in bed, read in bed, and so on. So that's something that I think it's a personal choice. But what the idea is that you want to use bed for sleep and sex, and anything else, your body does then loses a signal, because then the bed becomes just another place like a couch or your patio or something. It's a place. There's no strength and signal between your brain and your pillow going, oh, this is sleep. Now, if you are someone that doesn't suffer from insomnia and don't have any issues with sleep, you probably can cheat and do a lot of these things in bed, watch TV and read a book and so on, and check your phone and then switch it off on your phone. But if you have issues falling asleep, then looking at getting into bed only when you're ready for sleep and nothing more should be something important. The same way, like, if you're diabetic, then you can't really have that cake and eat the whole cake. You know what I mean? So if you have issues with sleep, you have to be honest about your what you should be doing in bed. It's not like, oh, my partner falls asleep, so I should be able to do that quickly. They put their phone down and they're asleep. I say, well, yeah, but they don't suffer from insomnia. You do. So it's a little bit different, and we have to kind of treat you a little differently. So shift workers, what we do, and some of the tips as well. A lot of times, one thing I'll tell a lot of shift workers is that if you're on a shift, you try to bunch them up. Don't do different shifts in terms of, sometimes some people have the night shift versus day shift, which is fine. But some people have 3 shifts, which is the early shift, the second shift, and then the third shift, which is the overnight shift. And you keep going back and forth within one and the other. That's going to be catastrophic. What you want to do is that if you're doing shift work, is to make sure you bunch up your shift work together as much as possible. Make a case, especially if you are suffering from a lot of fatigue and sleepiness coming out of your night shifts and so on, is to let your employer know, listen, can we schedule it so that we have all my night shifts in a row of 3 or 4 nights? And then I get back to recovery, and then I'll start my night shifts again. Instead of having your night shift on a Monday, Wednesday, and a Saturday night, it's going to get really messed up and your body's going to go back and forth. So try to bunch it up, one thing for sure. And you want to, if you end up having these rotating shifts within the first shift, second shift, and third shift, you want more of a forward rotation rather than a backward rotation, so that you end up aligning. It's easier to align that way, going clockwise. But tips. Now, if you're, for example, getting ready for work and you're working the night shift, is to make sure that you get adequate light exposure at work. So make sure your work environment is bright. Make sure that the medications you're on they're not sedating in any way. If you're taking any other medications and so on, like beta blockers and so on, or if you're on SSRIs, they may cause some fatigue. You may want to decide on shifting the time you take that. Again, there's no general rule about how antidepressants or some medications may have a paradoxical effect on you. So you have to see whether this medication doesn't give me fatigue and sleepiness. You want to kind of make sure that you work on your medication dosing at a time as well. Stimulants are great. So they're approved for shift workers, especially here in the US. If you know that you have a clinical condition where your shift work is causing you to be fatigued at work and not be attentive and poor productivity, stimulants may be something you can use. These are amphetamine type medications that are really effective. And they're short term use only when you're at work itself. The days that you're off, you don't need to take them. So that's where it benefits you the most. Caffeine use, timing the caffeine use, making sure that you don't take caffeine within about 4 to 6 hours of your bedtime. So example, if you get off shift at 7 o'clock and you get home by 8 o'clock and you try to get into bed by 8:30 or 9, generally you don't want to have any caffeine anywhere between 4 to 6 hours. Again, you have to be a little honest about how the caffeine affects you. Some people it's 4 hours, some people it's 6 hours. If you're pregnant or if you get older or if you have liver disease, another medical condition that may slow down the breakdown of caffeine, you may need a longer time as well. But caffeine's a good tool to use in addition to phototherapy, so light therapy at work, to kind of synchronize that to ensure that you get adequate sort of stimulation to stay awake. Because the part of staying awake at night is going to be artificial. It's not what your body's circadian rhythm is really used to, but you're going to have to try to align that as best as you can. Lifestyle, making sure that you align your exercise times, eating times, making sure the meals that you don't take huge large meals that are carbohydrate based right before you fall asleep, because then it leaves you really bloated, causes a lot more reflux and so on. So you want to take protein based food, especially if you're going to sleep within a couple of hours or an hour of eating, because you come back off a night shift. And I know a lot of us will want to kind of keep our day productive. We're coming back. We have like, oh my God, I have to stop by the grocery store. I have to do this. I have to do that. Just pause for a second, because your body is looking, when you come out of a night shift, if you get exposed to a lot more bright light, your body's going to go, oh, hey, it's I know you're feeling tired, but this is a signal for me to be awake. And so that fights again and gives you the restless sleep, because then your body's not ready for sleep. So I want y'all to be, if you have issues where you wake up later the day after night shift and you're feeling horrible, you have to be honest about trying to ensure that you wear sunglasses or you wear a cap when you're leaving work, so it reduces your light exposure. Reduce your sort of grocery list that you need to do. I need to stop by the bank, I need to do this, I need to do that. Try to be productive in the afternoon if you can, and leave those things for the afternoon, but try to make sure that you kind of synchronize your homeostatic drive, which is what has been building up throughout the night because you've been awake and doing stuff, so that drive to sleep is there. And you want to align the circadian rhythm, which is that light rhythm, to your homeostatic drive, so that you get home, you eat, you shower, or if you want to change, you get into bed, you have a nice cool environment, and then you try to go to sleep. Those are the things. You may need some sleep aids, and that's again sometimes that you may want to get that prescribed to help you fall asleep initially. And so that again, it can be used on a per needed basis as opposed to chronically used. And that's also another time that I'll recommend sleep aids for you. But I actually blogged about this, and so you can read a lot more in my blog that I have on my website. So it's under the resources tab, and you just feel free to read, and I appreciate your comments on that as well. I tend to blog frequently about things that affect me and affect my patients. I think my patients would benefit, and I appreciate your feedback, and if you have any other thoughts. But it basically puts together a lot of what I said, but probably in more coherent terms. All right, we have come to an end of our talk. I just kind of want to make sure I touched on the shift workers, because I know a lot of us have that in our daily lives, whether you're on call. If you all want to reach out to me on LinkedIn, I look forward to that. Any questions that y'all have. I've come up with a lot of teaching videos, mainly geared towards residents, doctors, nurse practitioners, nurses, and so on. So under resources, there's teaching videos for sleep medicine, there's teaching videos for pulmonary medicine, things that I felt that were missing in my curriculum that helped me kind of understand how to do things. A lot of curriculum teaches you a lot of the clinical basics, but not the how to. When do I need this? Do I need to repeat a sleep study? Do I need to repeat a pulmonary function test? So these are some of the questions that I try to answer. But it kind of gives you further resources beyond this talk today. And again, I welcome your feedback. And if you have any thoughts about what I should blog about, I'm happy to do that. But I will stop here, and I will open the floor and see if Omar has any questions. Anyone else has any questions? Thank you.
Thank you so much, Abby. This was really great. There's a lot of like really cool takeaways for me, and the biggest one is like, don't try to control the time you sleep, but try to control the time you wake up, or create a discipline around when you wake up and make that your biological restart, which is
Yeah,
a great.
that's going to be your flag post that you have to put in the ground as your wake time.
Yeah, and that makes it much easier even if something happens. So it's certainly like the social jet lag idea is a very interesting one. Never thought about it, but definitely relate to it. And also like the like how personal this issue is, how hard it is to talk about it,
Mm-hmm.
and how sensitive it could be, especially with your partner and spouse. I certainly struggle by this idea of like, okay, we need to sleep at the same time, and sometimes my wife wants to take a couple more hours, and so it's like it's an added burden because you don't want to like even uh, affect the relationship, and so it like stops us from talking about it.
Mm-hmm.
So creating kind of like that space and normalizing it with some of this information has been very
Especially
helpful.
when it, yeah, and you're right, especially if it affects you. I mean, I think like the example I gave was, a lot of patients like, my patient's like, well, he smoked, and why do I have COPD and blah blah blah. I'm like, if I could answer that, I'm happy, but it's affecting you in a way that's different, and so hence you have to deal with it in a different way. And the same way with eating cake and diabetes. If you have diabetes, that cake isn't really for you. As much as you want to be upset. So the same thing with sleep as well. Your partner's ability to get away with 7 hours of sleep, and you need 8 hours of sleep. That's going to be something that you have to address and actually be honest about and say, no, when I get honey, when I get 7 hours of sleep, I get tired in the afternoon and it's real drag. I notice that when on weekends and I sleep the extra hour, I feel so much better the rest of the day. So these are things that you have to, the best thing you have to do is kind of be introspective and honest about how it's affecting you. Same way we look at diet, the nutrition that we eat, how some things make us feel. And like, I feel great after exercising. I need to do that more often. So I feel great about certain sleep behaviors now, and I need to make sure I do that or incorporate that into my life.
Yeah, thanks for sharing that. And Avi, if I can have you stop sharing your screen, and so I can pin your video, and we'll take some questions now. That'll be a great time. We already have a couple of questions. And the first question was from Jerry, who I know will be having to hop off shortly, but her question was about pets. And what are your thoughts about people that want to sleep with their cat or their dog or their turtle?
Again, it comes back to how it's affecting you. If it is affecting your ability to be productive the next day, it's affecting your ability to perform the next day, then you have. Some people don't. Some people don't have any issues. We know we wake up a couple of times a night. That's normal for people to wake up a couple of times a night, but to fall asleep pretty much immediately within 5 minutes or so is also what's expected or what's normal. If you're waking up because of your pets and you're staying awake and you have to deal with that, then you kind of have to decide if crate training is for them and so on, or if, some way to figure out what the solution is with the cat as well. And it's a lot harder to do, but I think a lot of people don't want to do that, and they take the easy way out, which is to struggle with that, and then use caffeine to kind of balance out the lack of it. But it's the same thing with a sick family member as well. Sometimes you have issues that you just have to deal with, and it's going to be a very personal decision on that. I have I know that personally because I have two dogs, two Shih Tzus that are in bed with us, and a cat. And the cat is so what we did was the cat needs to go outside. I mean, it's an outdoor indoor cat. So my wife and I decided that the cat was too disruptive. It was always waking us up at about 3:30 to 4 o'clock to go outside. And as much as we wanted the whole family with us, it was a hard decision. But at 10 o'clock, I kicked the cat out, and it's worked so much better. But again, we could do that. I'm not sure whether your home environment is similar. So
Yeah, and that brings us to another question by Dr. Delhi, joining in from the UK, but head of research in a hospital in Nigeria, and he's asking about the effect of caffeine on blood pressure. Do you have any thoughts on that and how that can factor into better or worse sleep? You did mention a bunch of things about caffeine, but the
Yeah,
question is
it does.
about
It does
blood pressure.
drive some anxiety or tachycardia and so on because it is a stimulant in some ways as well. The effect on your blood pressure isn't. It is there, but it will be a very personal choice because again, some people will drink caffeine and not need to use the restroom, for example, in terms of peeing as a diuretic. I found, for example, caffeine, even though studies have shown caffeine isn't really a diuretic, for me it is. I know that for sure. And I've tested that on my own life multiple times. So how it affects your blood pressure, you will have to actually measure your blood pressure and see how it actually does. But you have to see whether the blood pressure increase is actually due to a lack of sleep as opposed to caffeine. Are you having poor sleep during the night that makes you drink a lot of caffeine, and your blood pressure is high because you also, what we need in blood pressure control is diurnal variation. That means at night it's low and in the daytime it's higher. And that sort of fluctuation is what keeps our vessels a lot more kind of compliant and flexible. The hardening of the vessels is thought to be when we lose the diurnal variation, you have sleep apnea or anxiety or insomnia, and the blood pressure stays up throughout the night. That's actually what drives a lot of the damage to our vessels, and then end up having a lot of risk factors for that of poorly controlled blood pressure. So I'd say we have to test and see whether it truly is personally something that jacks up your blood pressure, like you do a before and after I drink caffeine and it goes up by 5 points. That's fine. But you also have to see whether you're drinking that caffeine because of poor sleep that led to that caffeine need.
Yeah, and another thing that really struck me is how intertwined sleep is with food and exercise. You mentioned those two specifically,
Mm-hmm.
and I want to encourage everyone to come up and ask Avi any question that they might have, or leave drop in the chat. I have one of my own, Avi, around that. Like when someone like it seems like obesity and sleep are heavily correlated, and the when a patient comes to you and they already have problems with obesity or nutrition, and they're not moving that much, but they're still trying to get sleep, where is like a good place to start? Because we're on the program, we're tackling all these different modules, but we're trying to tackle them sequentially. But uh, just hearing you speak, it's like they're all intertwined. So you
So
can't
my
use all three together, right?
Yeah, and so this is where I'll be my bias comes in, and I'll answer Jerry's question. Jerry had a question about waking up at 2:30 or 3, but let me answer this question first because I think it's an important question, and it's also a bias that I have. What I find is, poor nutrition, lack of mobility leads to weight gain. You have that weight gain, you start having more medical problems, aches, pains. You have more reflux that disrupts your sleep. You have poor sleep. You start then coming up with enough weight gain that you start maybe snoring and having sleep apnea as an issue. So you have this vicious cycle now where you're getting poor sleep, and then that poor sleep stops you from actually managing a good diet the next day or more mobility the next day because you're tired, and it just becomes this vicious cycle that keeps going on and on, this medical condition. So I find, and this is my own personal practice, and I think it's a bias as a sleep physician, I find the best way to, and I have, the reason is I've seen too many people fail at this where they'll say, doc, I don't want CPAP. I'm going to lose weight. And I'm like, holy shit. Okay. That's not going to work. The reason why you're talking to me now is because weight loss has not helped. You've come to a point where you at home and you've been doing this on your own, and you know exactly what you're eating. You know exactly the weight. You've seen your weight. You've seen your pants grow size. You know it's happening, but you weren't able to intervene on your own. And that's the reason why you're sitting in front of me going, I can't sleep. This is an issue. So I find that if I detect sleep apnea, and I will, especially in obesity and snoring, or anyone has poor sleep and has risk factors of sleep apnea, because I think we associate obesity so much of it. But when we look at the Asian population, we find that you don't actually have to be American size obese to actually get sleep apnea. A lot of my South Asian patients are normal sized, our BMIs of 23. It's just that how our facial structure is as we get older, as we have internal obesity as well, because of all the accumulation of tissue, occurs differently in everyone. So what I tell a lot of my patients is actually, let me treat the sleep apnea first. Let me break the cycle that you're at. Let me give you good breathing when you're asleep. Let me get you good sleep so that when you do wake up, you are ready to make those decisions about health, you have the energy to be more mobile. When you end up getting better sleep, your pain perception is also improved. So that also improves your aches and pains that has stopped you from exercising and doing stuff. Because all of this, like you said, is a vicious cycle. So for me, that sort of intervention is actually, no, you will lose weight. You focus on losing weight once we treat your sleep apnea. And that's my bias, because I'm a sleep doctor and I can put on a CPAP and help them immediately with their sleep and actually kind of try to break that cycle. And then it gets back to the patient and go, okay, now I feel better. Ooh, let me do this, let me do that. I've got time in the morning. I wake up more refreshed. Let me go ahead and let me do a plank, or let me do this, and let me go ahead and I've got extra time. I feel more refreshed. Let me go ahead and make my breakfast, or make my lunch to pack to work as opposed to snacking or whatever is in the cafeteria. So that's the decisions you make on the medium to long term. But the short term is to break that cycle. And I always feel that if I can screen someone with sleep apnea and treat that sleep apnea, that gives the patient the best chance to kind of break out of that cycle. Because the weight loss, unless of course they're going through bariatric surgery, it's going to take time. And a lot of the times the patient is sitting in front of me because they haven't really taken all those heeds on the signals along the way, and they've come to the medical point where it's becoming a medical issue.
Awesome. Thank you so much, Avi. You're a pioneer of many things, as always. I love like the personalization of it. Your aspect into looking about what works for each patient, and even across different countries, and looking at it from that such a global perspective is very interesting, and it gave us a lot of food for thought. We do have some more questions, but we also want to make sure we have time for breakout so that you guys can actually participate and help each other with some of this information. And so I'm just gonna throw one last question. If you can, if there are like top three pieces of advice, Avi, that you can give us in order to be able to have that like strict, sleeping and waking up at the same time. You did give us like this insight about like being diligent about waking up. Doesn't matter when you sleep, but wake up at the same time. Is there anything else that you can kind of give us or tell us that can kind of help make this easier?
Yeah, no, definitely. I think the wake time is, for me, it's the first step that you have to make, is that flag post that you said, this is the time I'm going to wake up, and your body will. Now, what you do, there's a question as well, what you can do to ensure that you are. So what you're trying to make sure that you do is trying to ensure that you have that homeostatic drive at the end of the day, that you actually are tired enough. What I found, and this is on a personal level, and no studies have been done, I found that patients actually, now that they work from home, they don't get as much outside exposure. They're inside their homes. And I'm not sure what the light exposure is within their homes as well. They're not mobile because they don't actually get up, walk to the bus station, go to work. They're not getting in their car, driving. They're not walking around the office. They're not walking in the office to the cafeteria. They're not doing a lot of these activities that used to exhaust them. So physically, the exhaustion is not there, and they tend to just be at home on their couch or sitting at the desk. Yes, it does, but while it does tire you out, you're not getting the physical, that mobility that you used to when you actually had to get off your ass and go to work. Excuse my language. But so getting enough light exposure, getting enough daily mobility and exercise, and I'm not talking about exercise like joining a gym, just talking about mobility, doing a lot more stuff that you should have done, like, which is don't take the car, don't take the elevator. These kind of things will definitely drive towards increasing that homeostatic drive, so that 16 to 18 hour mark, when you're awake already, if you wake up at 6 o'clock every morning, by 10 o'clock, I guarantee you, unless of course you have severe anxiety or some sort of medical condition that doesn't allow you to sleep at 10 o'clock, you're going to start feeling sleepy. So ensuring that you get enough daylight exposure, looking at your life, looking at how much exposure you get. I've had patients who, for example, have been working from home, they're coders, and they're working from home and lines of code, hours and hours and hours in their room, drinking caffeine, monster drink, and so on. So that affects their ability to fall asleep. But then it also doesn't give them enough light exposure that they require, so that so that they're not really fully awake. They wake up at 9 o'clock and they're sitting in their room in the morning. And so those kind of things you need to kind of be aware of as well, your light exposure and your homeostatic drive and your mobility, that's important.
Thanks for all the really practical points.
I gotta thank my patients for doing that, because they've helped me kind of create my way of style, because I think a lot of tips that I get is not for my own. It's actually a lot of what my patients, listening to their lives, listening to what they are doing, and so on. So I think that's been really helpful.